Hello, welcome to Preventive Healthcare. I am Umanath. This video is a continuation of the part 1, and in this we will see very specific, easy to use and simple instructions for protecting the health of our senior people during the lockdown. There are 6 important recommendations. There are 6 important recommendations included in this video, which can be applied on a day-to-day basis, and that will help them to face this difficult situation. We will go through all the 6 of them. Watch the entire video. You will get a very detailed input on how to do. Before we go, I thought we should see the intent quickly and then move on. You see a beautiful car in this picture. It's an old car, but well maintained. I feel prevention is doing a lot to this car in terms of servicing, in terms of periodical maintenance. This car is in a very good condition, very unlikely to break down. The same thing applies to our body. Are we actually doing it in the right way? This video will help us to do it in the right way. Various governments have extended the lockdown and they are reviewing the situation dynamically. We are not sure when the lockdown is going to be over. It may get extended for a few weeks or even few months, or may even go up to the beginning of next year. Are we really prepared? Are we really supporting our seniors to face this extension of lockdowns? The main reason is their metabolism is becoming slower due to lockdown. And because of the metabolism that is going in low gear, people who are above 60, they are going to face the maximum risk. We will see how this risk can be reduced so that they can go through this difficult period comfortably. As I said earlier, there are 6 important inputs in this video. Let us start with the first one. Ensure all the moving parts in your body are moving every day. How do you do this? You can do it 20 minutes in the morning, 20 minutes in the evening, some simple body movements by following some stretching exercises or some yoga positions with that you are comfortable, or it can be even walking if you have enough space inside your house or inside your compound. When we do so, the movements in all the body parts maintained on a daily basis will help you to maintain your metabolism at a very decent level in spite of the lockdown extensions. The second recommendation is supplementation with micronutrients. The recommendations are multivitamin, multimineral tablet with breakfast, vitamin D3 4000 IU with breakfast, vitamin E 400 IU with breakfast, calcium citrate with vitamin K2. There are tablets available, and this form of calcium is better than many other forms of calcium like calcium carbonate. Calcium citrate, the body absorbs easily and quickly, and the bioavailability is better. And ensure that these 2 ingredients are there in the tablet. There may be other ingredients that is also fine, like phosphorus, magnesium, potassium, that also helps to improve your bone and joints. The next supplementation is glucosamine, 750 milligram, that can be taken with lunch, and also take omega-3 fish oil or cod liver oil capsule with dinner. All the supplementation recommendations are written in this presentation, followed as written in this recommendation for 30 consecutive days. After following 30 consecutive days, reduce the frequency from daily to weekly twice. Take weekly twice after 30 days of consecutively following the recommendation. If seniors are having some existing medical conditions like diabetes, increased blood pressure, hypothyroid, or any other condition that they are following essential medication, then they need to continue all the essential medication. Do not stop them. Follow all the existing essential medications like diabetic medicines, hypertension medicines as recommended by your doctor. In the supplementation section, there is one caution I would like to highlight. Patients who are having kidney disease or patients who are undergoing dialysis or patients who have gone through transplantation, they should not take supplements. If at all they want to follow, they need to consult their doctor who is treating the kidney condition. After consulting, if he agrees, they can follow. Otherwise, do not follow without consulting your doctor. Third recommendation is to improve your digestive system. The digestive system is like the root of a tree. So improving the digestive system will help us to improve the health of the entire tree. So seniors, if they can improve the digestive system, it will help them to become better overall. We find many seniors are having conditions like diabetes. This is very prevalent in some countries, and some countries this is less, this population is less. So I thought it is important for me to give specific consideration for non-diabetic patients as well as diabetic patients. For non-diabetic patients, the recommendation is triphala powder quarter teaspoon, ghee quarter teaspoon, melt and use it, honey 2 full teaspoon. Mix all the three and take 20 minutes before dinner. Mix all the three and take 20 minutes before dinner daily. For diabetic patients, triphala powder half teaspoon in a glass of water can be taken after dinner daily. Or they have one more choice. Take 2 spoons of coconut oil with dinner daily. Take 2 spoons of coconut oil with dinner daily. Follow these recommendations for a period of 30 consecutive days daily. After 30 days, reduce the frequency to 2 times alternate days. So after the 30 days, frequency can be taken and be reduced to alternate days. This reduced dosage will help you to maintain your digestive system at an optimum level. The fourth important recommendation is about food. I have given very simple recommendations, but all are important in this. And when the digestive system is good and when you follow this, it will help you a lot. Drink warm or plain water. Do not take chilled water, even during summer. Chilled water can slow down your metabolism significantly. So always drink warm or plain water without chill. Follow 1 or 2 cups of clear vegetable soups in a day. Clear vegetable soups, 1 or 2 cups in a day. Do not take any ready-made soups or do not use any corn flour or any thickening agents for the soup. Simple, clear vegetable soups made at home naturally. Whatever meal that you eat, whether it is breakfast or lunch or dinner, ensure that the meal is served either warm or hot. Do not take if the food is too cold. It can also slow down your metabolism. Your digestive system may find it difficult to digest if it is cold. Regarding vegetables, I request seniors to take only cooked vegetables. Avoid raw salads as far as possible. Cooked vegetables can be digested easily, and the method of cooking can be either steam cooking or boiling or sauteing. Any simple method is fine, but ensure that the vegetables are cooked before you eat. Protein should also be part of your routine diet because seniors get muscular pain, muscular cramps, leg pain. All these things are happening to many seniors. Lack of protein is also one of the important causes. When you start losing your muscle mass, and if the protein is also not there enough in your diet, your difficulties can increase. So either take an egg daily or take some vegetarian protein like brown chana, dal, sprouts after cooking. Like this you can take. It will help you to meet your protein requirement. Take few nuts and dry fruits also daily. They give lot of minerals. They give you a lot of good fats and oils. They can also energize you better. Overall, take simple and easily digestible foods and follow the above recommendations. And also ensure that your diet has got all the four macronutrients every day: carbohydrates, proteins, some fats and oils, vegetables, and fruits. All should be there every day in whatever you eat. And youngsters or people, those who are obese, can reduce carbohydrates significantly. But on the contrary, seniors should not reduce carbohydrates. Normal seniors should not reduce carbohydrates. If they reduce, they will get more tired. They will feel lack of energy. So take decent amount of carbohydrates. Take good protein, fats and oils, and plenty of vegetables and fruits. This is what will help you. This is as important as the digestive system. Both are two sides of the same coin. This will strengthen the entire tree. Follow it, it will help you throughout your body. Fifth important recommendation is to boost your immunity. Because of the lockdown, as well as the looming threat of this coronavirus pandemic, it is very important to improve or boost your immune system. When you have a better immune system, when your immune system is capable of fighting any kind of a viral infection, that means antiviral properties, then it is in a better position to give you an excellent defense. And this defense is very important considering the current situation. Even if we take several months to get the vaccine, boosting immunity and following all other steps given in this recommendation will help you to keep your body in one of the best level of defense, robust defense, so that you can sail through this most difficult period. The antiviral mix contains four ingredients: turmeric powder, cinnamon powder, black pepper powder, dry ginger powder. All the four ingredients, the recommendations of how to mix, what quantity to be used, all are given in writing in this presentation. Please go through, prepare accordingly. Once the mix is prepared, keep it in an airtight container and use it daily. The recommendation for seniors is take quarter spoon of the antiviral mix that you have made. Dissolve it in a glass of hot or warm milk only. Dissolve it in a glass of hot or warm milk only and take daily once. Take daily once. When you can take in the morning or in the evening or in the night. Whatever time you take it with glass of milk. And after taking it daily for 30 consecutive days, no need to continue daily. You can reduce the frequency to weekly twice and maintain it. The sixth important input, which is very simple, but it will help you because we have two category of seniors. The first category, they were all active throughout their lifetime, and because of the lockdown, now their activities have come down. The other category, they were not active even in the past, maybe due to their nature of work, or they had some constraints, or they were not able to allocate time, so various reasons. The first group who were active earlier will be able to easily start their physical activity and continue, like whatever we have discussed. But the second group may face some initial difficulty in starting the physical activity. So I am giving two simple recommendations which will help them to overcome the initial difficulty of starting the physical activity. So for diabetic patients, take 1 glass of electrolyte 30 minutes before you start your physical activity. Take 1 glass of electrolyte 30 minutes before you start your physical activity. For non-diabetic patients, you can take 2 bananas and few dates 15 minutes before you start your physical activity. And when you do so, what it actually does, it helps you to give you the required energy and also balance in terms of potassium, which is very important for you to have the required muscular strength to start the activity. And if you follow these simple recommendations, even if you find it difficult in the first few days, you will start noticing that your difficulty eases gradually and you are able to cope up over a period of time. So these two may be very simple, but I feel you need to make an attempt to try and see how it works. So we have seen all the six. To sum it up, whether you have done it in the past or you have not done it in the past, it does not matter. No matter how hard the past, you can always begin again. Start somewhere. And some of you may be able to follow all the six recommendations right from the day one. Some of you may not be able to follow all the six recommendations from the day one. Start with a few, then keep on adding. Finally, you will be able to reach and do all the six. So make a good beginning. Thank you very much. If you find this video helpful and valuable for improving your health and quality of life, please share it and forward it to others. Request you to subscribe to get intimation for such enriching videos in the future. Recommendations given here are meant to improve your health, improve your immune system, and strengthen your body. In case if any one of you are clearly noticing coronavirus symptoms, please contact the respective doctors or hospitals so that they can provide you and ask you to follow the necessary treatment protocols. Ensure that you have a relook at what we have discussed in this video, and those who have not seen this first part, I request you to see the first part also. Thank you very much. I'll see you in the next video.